I'm Dr. Angela Mackay, chiropractor and naturopathic physician, and we are talking about SIBO this week. So SIBO stands for Small Intestinal Bacterial Overgrowth, and the symptoms of that are things like bloating, gas, either burping or tooting, cramping in the abdomen, constipation, diarrhea, combination or alternating of both constipation and diarrhea. You can have nausea, joint pain, food sensitivities, rashes, eczema, anxiety, depression, and brain fog. So all of those things are possible when you're having SIBO. So obviously all those things don't necessarily add up to mean SIBO, but they can be a part of that. So you want to get checked out. And if you're dealing with chronic, constant digestive issues, indigestion, you've got to be really picky about what you can eat because you know it's going to come back to get you later if you eat something that's not on that approved list for you. Then you really want to get that checked out and taken care of. It cuts into your family and social life significantly. So like if you're at a birthday party, maybe you can't eat the cake, or you can't eat what's served someplace that you're going, or you can't join in with everybody else in the activities that they're doing. And food, so much of our social life revolves around food sharing, enjoying food together, enjoying a meal together, that it really can feel like you're missing out if you're having these issues. So if you've got these things and you've gone to your regular primary care doctor, if you're lucky, they maybe have said something like, oh, it's just IBS, it's just, it's stress, cut your stress. I've heard that from patients, or increase your fiber. And sometimes that's not a great idea because these intestinal bacteria that are living where they shouldn't be digest certain fibers, and that causes more gas and more bloating as they metabolize that fiber that they use for food. Adding more fiber, depending on the type of fiber you're adding, can make your symptoms worse. So just adding more fiber is not necessarily going to cut it. It may actually exacerbate the situation. Some doctors may have told you to start a low FODMAP diet, and you're like, what the heck is that? Maybe they gave you a handout. Maybe they just told you to do a low FODMAP diet and left you on your own to sort of figure out what that actually means. And there's a lot of great resources on the internet, but if you don't know where to start or where to go and you don't have any support, that can be a big challenge. And in and of itself, the low FODMAP diet is helpful if you have SIBO, but it is not necessarily going to be the cure, and it's not a fun diet to stay on long term if you really don't have to and there's another option. Sometimes if you've seen your regular doctor, maybe they've put you through a colonoscopy or an endoscopy and they say everything looks great, and so they've taken the steps necessary to rule out some of the big things, but not really giving you any sort of tools to deal with the symptoms that you're experiencing. Definitely with SIBO, because of that inflammation at the cellular level, there is some leaky gut happening. Now, whether leaky gut was the thing that started it, that may have been the start of the SIBO, but it also may be a result of the SIBO. So either way you go, you may find that you're having food intolerances, not just with getting symptoms like the nausea or the gas or the bloating, but you may be having other symptoms like we talked about, the rashes or things of that nature, where things are passing through the membrane of your GI tract that shouldn't be. The bugs that you may have, or the bacteria in small intestinal bacterial overgrowth, you can have pathogenic bacteria, or you could have even good bacteria. It's just in the wrong place. So you're supposed to have a good microbiome, a good bacterial flora in your colon. That's where your gut bugs should be living. They shouldn't be living in your small intestine. And so when they come up further into the GI tract where they're not supposed to be, that's when they start causing some significant problems, even if they're not necessarily a pathogenic bug. These bugs in the small intestine start to metabolize the food that you're eating there, and so they're eating what you're eating, and they start to digest that, and they start expelling their own gas and waste and everything in your small intestine, and that's why you get that bloating and discomfort there. You don't have the same type of pain reception in the GI tract that you have in other parts of your body. So usually when you experience GI pain, it can be due to stretch, too much stretch from that gas and bloating. It's just causing a stretch on your small intestine that leads to that pain. These bugs really love starches, they really love sugar, they really love, like we talked about, soluble fibers, and so you have to be careful about what you're eating because you don't want to give them stuff that they love to eat, because then they just have a party and it's not a party for you. You're left having to do the cleanup metabolically. The most common cause of SIBO is food poisoning. So if you've ever gone out and had some questionable food and then had traditional food poisoning symptoms 4 to 6 hours later, vomiting, nausea, diarrhea, those things, your body's trying to get that bad bug out of your system any way it can, that oftentimes is the first sign that you are going to potentially end up with SIBO. Now, not everybody that gets food poisoning gets SIBO, but it is the most common way to get SIBO. And the good news is that when it's food poisoning and you're never well since that time that you had whatever it was that gave you food poisoning, that often, if we take care of it early, can be the end of the story there, and you can go on and not have any further troubles. We talked about a case earlier this month in a young woman who had food poisoning at Thanksgiving, and she and her mother-in-law got sick. Her mother-in-law recovered, but she didn't, and she'd never been well since then. We did 1 round of treatment for SIBO, and so far so good. She hasn't had any recurrence. However, there are other things that can lead to SIBO, and there's a long list of conditions that can predispose you to having small intestinal bacterial overgrowth. Some of those things include low thyroid or hypothyroid. That can also be things like hypermobility syndrome or Ehlers-Danlos syndrome, Lyme disease, other autoimmune conditions that slow down the nervous system, because anything that slows down how quickly your food goes through your GI system can lead to small intestinal bacterial overgrowth. The other things that can be problematic are low stomach acid, and some of the symptoms of low stomach acid are very similar to the symptoms of high stomach acid or too much stomach acid, and that can be heartburn or GERD or indigestion, burping, some of those things, reflux. So those things can be a sign of either too much stomach acid or not enough. Typically, as you age, you make less stomach acid, and the less stomach acid that you're making, the less you're digesting your food before it moves along in the GI tract. It changes the pH, and this lower pH makes a nice environment for gut bugs to be where they're not supposed to be. We talked about stress when we talked about food hygiene or eating hygiene, and so you want to be in the rest and digest mode. If you're stressed out, if you're in fight or flight, you're not going to be secreting stomach acid, and you're not going to have the appropriate stomach acid that you need to be able to digest your food. So that is one thing that can be really important in terms of avoiding SIBO, and during the recovery process, really you need to pay attention to sitting down and getting into a rest and digest state to help you be able to recover long term. Now the testing, if you think you have SIBO, if you've got all these symptoms, you've ruled out inflammatory bowel disease, you've ruled out H. pylori, you've taken a look at the pancreas function, and your doctor's like, well, I don't know, it's just stress, maybe just, try eating more fiber or try a low FODMAP diet. The testing for SIBO is pretty basic and straightforward. You drink a substance called lactulose. It's unfortunately, or fortunately, a substance that the gut bugs in the small intestine love to digest, and so they will take that in. It's a sugar, and then they will start to metabolize that. After you get that into your system, you take a baseline breath test before the lactulose, and then you breathe into these tubes at regular intervals, and you're looking to see if you're off-gassing through your breath coming up through the esophagus, through the mouth, if you're off-gassing any of the typical gases that these gut bugs like to excrete. So I usually do a 3-hour breath test to see if those levels rise, and that gives us a clue about which bugs are involved. So the gases that we can look for in that are both methane and hydrogen. Now there are other kinds of SIBO that you can have that include hydrogen sulfide, and there's not a great test for that, but usually on that same breath test, you'll have all the symptoms of SIBO, everything else has been ruled out, but then the levels don't rise at all. You just have a flat line, and none of those gases are excreted. You can also have small intestinal fungal overgrowth that can cause all the same symptoms, and you wouldn't necessarily be able to see that on this test. But if you've ruled everything else out, then that is where you should probably focus next. It's important to remember, like I said, that like about a third of people will have SIBO, maybe from food poisoning, because that's the most common cause, and then they recover really nicely with 1 round of treatment and then go on their merry way and don't have any problems. However, about 2/3 of people who have had SIBO for a long time, or they have some of those underlying conditions that we talked about 2/3 of people have a relapse, or they need multiple rounds of treatment to rid themselves of the condition. And so that can be something worth knowing, so that you don't get discouraged if you happen to fall in that group of 2/3 people and think, well, I did the treatment and I'm still having issues. Just know that that's typical for some people, and 1 round maybe was not enough for you to get rid of all of the gut bugs. Treatment includes antibiotics, and there are certain antibiotics that just release in the gut, so you don't get the systemic side effects of the antibiotics. And then I also recommend herbs with that, because the research shows that herbs are as effective as antibiotics, and they rid SIBO over 85% of the time, one or the other, and at about the same rate. But if you combine them together, then your success rate goes up into the mid to high 90%. So you have a much better chance of getting rid of the gut bugs if you combine the herbs with the antibiotics. So if you've been frustrated with your symptoms and the care that you've gotten up to this point and haven't really gotten a solution, and you're still dealing with all of this indigestion, it's really important to get in and get treated by somebody who knows what SIBO is. It is totally treatable, and it can oftentimes go away completely, or at least be improved so significantly that it's completely manageable and not upending your life. So make sure to get in and get seen with somebody who's qualified and knows what they're talking about when it comes to SIBO. If you have any questions, drop them in the box and I'll be happy to talk to you again soon.